A heart attack, medically known as myocardial infarction, it is a deadly medical emergency where your heart muscle begins to die because it isn't getting enough blood flow. Heart attack can cause permanent heart damage and death. Heart is located in the upper thoracic cavity at the center of our chest in between the lungs. The heart lies above the diaphragm and behind the sternum. It is estimated that the size of an individual's heart is equal to the size of his closed fist. The heart of a fully grown healthy individual weighs about 200 to 300 grams. About 5.6 liters of blood circulate the body, and 3 cardiac cycles are completed per minute. The primary function of the heart is to pump blood throughout the body. It supplies oxygen and nutrients to the tissues and removes carbon dioxide and wastes from the blood. Warning signs of a heart attack: chest discomfort. Most heart attacks involve discomfort in the center of the chest that lasts more than a few minutes. Or it can feel like uncomfortable pressure, squeezing, pain chest. Discomfort in other areas of the upper body parts include both arms, the back, neck, jaw or stomach. Shortness of breath. Sweating. A heart attack happens when something blocks the blood flow to your heart so it can't get the oxygen it needs. This tissue death can cause damage to your heart muscle. Myocardial infarctions, mean death of heart muscle. Vomiting, severe weakness, anxiety, fatigue, or shortness of breath. Key risk factors for heart disease: high blood pressure, also known as silent killer, high cholesterol, and smoking. Some risk factors for heart disease cannot be controlled, such as your age or family history, eating burger, pizza, soft drink. Treating a heart attack means restoring blood flow to the affected heart muscle as soon as possible. This can happen in a variety of ways, ranging from medication to surgery. Restoring circulation to the affected heart muscle is usually done with a procedure called percutaneous coronary intervention. Often called PCI for short, this procedure uses a catheter-based device inserted into a major blood vessel, near upper arm. Once it reaches the location of the blockage, the provider will inflate a small balloon on the end of the device to widen the blood vessel and clear the blockage. Recap again to get clear idea. In angioplasty, blocked blood vessel is cleared. The catheter is inserted into the blood vessel through a small incision. The provider threads it up to the blocked artery on your heart. After angioplasty, blood flow freely to affected area. After treatment, you can enjoy your life.